everyone. Live from New York, it's Saturday night. No, sorry, I always wanted to say that. So as Daniel has mentioned, I'm a medical doctor. I've been working with digital health for over 10 years. And the thing is that I really like games. And that's kind of like the defining feature of what has been my career in digital health. So if I show you this, how many of you know what this is? So what is it? Like, shout it out. Guitar Hero, yeah. Like, this is a controller for a gaming device. You play that you're a rock star. If I show you this, what do you think this is? Arrows? Actually, not quite. This is actually a bolt. It's from a crossbow. And the reason that you know the difference is because of the length and all of these things. It's lighter. It has to be traveling to a crossbow and all of these things. Now, what's interesting about this is that I actually have no idea about weapons. And I'm originally from Argentina, as Daniel said. But I knew about this way before I knew how to speak in English properly because of gaming. Now, if I show you this other slide, there we go. What do you think this is? Twitch, very nice over here. So we have a gamer over here. So actually, this is Twitch. This is one of these platforms that are online that you can broadcast people playing, and there's thousands of people watching someone play. And how many of the people here actually play video games or game on their own? Like, okay. Not as much as you expected, because actually there we go. Actually, in America, in the United States, and actually in the world, about half of the population actually plays video games. We're very common on doing this, and it's one of those things that really drives the engagement and drives the things that we can do. So there's a very simple reason for that, and that's because playing is older than everything. It's something that goes even beyond what human people can do. It's something that goes beyond culture. It's what animals do without even being trained to do. And this is a quote that I really like about this philosopher. And it actually goes back to even when I was seeing patients as a primary care physician. No one had to tell me that I had to play with my patients to make them smile, to make them focus. And you can know that this is an old photo because, well, it's in black and white. I also had more hair. So, but that was the thing that you're probably thinking now, okay, so how does this connect to healthcare? How does this connect with something that you can do on your own? And the thing is that at that time, I was working as a medical doctor. I was seeing patients, and people were telling me all the time that gaming is just for having fun, that you can never really do anything that is very complex or anything like that. So I took the example of a common game which was called Plants vs. Zombies. It was a tower defense game. The idea was that you see the plants, and the plants defend you against zombies. Sounds simple enough, right? So this is what happens a few levels later. Like, it's so chaotic, it's so complex, there's so many factors that are going there. And I figure, well, how can we actually do this to tie with healthcare? So I started working in immunology at the time, and and what I was doing was creating a game on my own that basically translated how does your body fights off infections. So you have bacteria, you have all of these things fighting around. And if you go to how can you actually do this in a way that is healthcare, there's this type of solutions that these are very common. This is actually a fitness activity. You're running and you're listening how zombies are chasing you. Well, I mean, it's motivating, I guess. And then you have things like Wii and the Switch and all of these things that are more like mainstream, that basically you do exercises and enemies get beaten down and so on. And of course, we all know like the craze that Pokemon Go was a few years. But we have these kind of things now that are kind of like therapeutics that you can do, and you can play games as a way to get better. And I really like this. And the problem with this is that because you really like games, you think that gamification is the answer for everything. And it's kind of like one of those things that everyone says, well, what's the answer? Well, just do gamification. Now, Over the past few years, I've been working with people with multiple sclerosis. This is a neurological disease. It's degenerative. It's progressive. People have this condition. They have mental impairment. They have mobility issues. They have all sorts of symptoms, and they keep getting worse. So how do you apply this kind of thinking, this kind of tools to them? So there are solutions out there at the moment. So for example, Floodlight is a solution that through mini games and type of things, you can actually track how well is this person's mobility by putting the finger on the screen. Or you have solutions like Med Rhythms, in which people who have gait problems, they hear music, and that actually guides their steps and actually effectively changes the way they walk, and it's more feasible for them to walk like they used to. So when I approached this problem, one of the things that I thought was, well, how can we actually make this into a game? How can we make this, the creation of these solutions, in an actual game? So what I did was I went through workshops across the world. I actually went to conferences, medical conferences, design conferences, patient conferences, neurologists, IT, and I proposed to do workshops doing board games where everyone, with patients included as well, with everyone actually trying to come up with how can we create a gamified experience for people with this condition. And we ended up having this concept, this idea, of more stamina, in which it's kind of like an activity list, a to-do list, where what you have to do is you start your day with 100 points of energy, you plan your day, you say that you're going to go and do shopping or groceries, and you think that this is going to be 20 points, 50 points, and so on. And what happens then is that the system tells you when you're done, okay, how good were you at estimating this? Simple enough. But what happens is that on the background, we keep track of all your physical activity and what are the factors that have led you to this place. And we combine this with surveys and standardized tools that you can actually embed, and we get an understanding of what is the profile of your actual physical activity. We use this information to give you input, to provide you and prompt you in things so that we know, okay, we know that you're going to be tired based on the way that you're doing this. And we also know, because you have your phone, we know basically what's the situation where you are. Is it hot? Is it warm? Is it sunny? Is it raining? And we keep all of those things in mind, and then we provide recommendations, and we understand these things. Because, you know, it's not the same for you or for any of us to go out for a walk when it's snowing, like in Finland, or when it's sunny, like it's supposed to be in San Diego. Yeah. So, the interesting thing about this, one of the reasons that I'm so proud of this type of work that we've been doing in terms of gamification, digital health, is that on the one hand, everything has been, as the previous speakers mentioning, about evidence-based. We actually have huge amounts of research that we've been working on in each of the steps, from the idea, from the prototyping, and all of these things. These are publications. But the most important thing is that we actually have patients reaching out to us, telling us, hey, can we try this? Can we do this? How can we use this tool? So this is a bit about what's near and now in that sense. We've been working on these tools. They're all around us, and it's just a matter of putting this into the hands of healthcare professionals, of patients, of everyone, so that we can actually be healthy by playing. But where can we go next? Well, it's relatively simple, right? We already know that there's GPS and geographical information about what you are. So if, for example, in breast cancer or in multiple sclerosis, we know that the person is in a place that we know it's a hospital for 4 hours every week, or are they getting chemo? Probably. So can we just provide some information, some tips for them to do this? Or we have been talking now about ChatGPT and the natural languages. So can we just create recommendations that are tailored for that person? We know that maybe not all of you know like zombies. Maybe you like dinosaurs. Maybe you like things that are less gameful. what if we use these recommendation systems to generate stories for them that adapt? We know that there's people who are using AR. We know that there's people using Twitch and watching people get healthier. So could we not have like a system where someone encourages just by watching you? And that's one of the things that is so interesting about this, is because no matter the type of person that you are, what is your situation, what is your position in this, we can always try to figure out what's the gaming solution, or what is something that's going to make you more engaged with that. And we don't know what's going to come next, but we always know that we want to play a little more. So thank you so much for your time.